Tell me a little bit about the peptide BPC 157.
Sure. So BPC 157 stands for Body Protected Compound 157. The beautiful thing about this peptide, I should say most peptides, it occurs naturally in our bodies. It lies in our gut. BPC 157 has a plethora or a large amount of instances or reasons why we can use it. Some of them include wound healing. So if someone has something simple as a scrape, compared to like an ulcer or a deep wound, it can help heal that wound in a faster time, and by promoting more blood flow, oxygen, and nutrients to that area. Same thing goes along with muscle and tendons as well. So for those people who do a lot of physical exercise, it really can help you get back to exercising a lot quicker and feel better, not as sore. Another thing that it can do is it works on the GI system. So the gastrointestinal system, a lot of people think that's the stomach. So stomach, intestines, colon. So what it does with that is it reduces heartburn to the point where it eliminates it completely or gets rid of it. I personally take BPC 157. I've had a couple peptic ulcers when I was younger, and I dealt with heartburn my entire life. After going on proton pump inhibitors like omeprazole and Pepsid, taking Tums or Gaviscon all the time to help kind of cool things down, I started taking this BPC 157 and I don't have heartburn anymore or peptic ulcers. Virtually what it does in that area is it helps to decrease inflammation in the gut and GI system, the entire GI system, helps with the balancing of the flora or bacteria or the proper amounts of good bacteria versus bad bacteria in our bodies, and helps us with the digestion as well. Another thing that it can do, which is really great, is working on the brain and the what we call neurotransmitters, or these chemicals and hormones that help to have our brains function appropriately. So a lot of people deal with pain, anxiety, depression, and it takes a toll on a lot of people over time. A lot of people don't want to take, or what I've come across in my practice and just talking with people, is weight gain when taking an antidepressant, and it doesn't cause that. It doesn't cause any weight gain in that aspect. What it does, though, is it increases the dopamine neuroreceptor, the serotonin. It also helps with the opioid. It works on the opioid system or the pain system of our bodies to help decrease pain. And it also works on the GABA or GABA receptors as well, which are throughout our entire our entire body. With GABA, as GABA goes up, it helps to decrease anxiety. So it can take away some of the anxiety as well. Dopamine and serotonin, dopamine, a lot of these are interconnected with antidepressants because that's what they're trying to focus on. This medication helps to increase both of those. So if you have ailments such as addiction tendencies or confusion, or you can't get the words out right, concentration, this will help with that as well. It's a pretty good medication, or supplement, peptide I should say.
All right, yeah, it sounds like it could do a lot of things for you. So in very simple terms, what are some of the reasons you would prescribe BPC 157?
So some of the main ones that I like to look at is heartburn. Heartburn happens with everybody, whether you use the food you eat, like spicy foods, or fast foods that cause a lot of inflammation and prolonged inflammation, leading to what we call leaky gut, or just, if you drink too much alcohol, things of that nature. Anything that can irritate the stomach can cause a heartburn or a reflux to come back up. It works great with that. It's not something you want to take and then, now I can drink alcohol again, or, now I can eat all this spicy food. No, you don't want to focus like that, but it will take away the heartburn which is connected to those types of illnesses. some other reasons why would be, again, when I hinted on the exercising. People who want to exercise or exercise feel a lot of discomfort afterwards, or soreness or tightness. The BPC kind of helps to decrease that by decreasing your pain, or increasing your pain threshold, we call it, as if you're taking a mild pain reliever. And it kind of gets you back in the game by promoting more blood flow. And with blood comes nutrients and oxygen that our muscles and tendons and ligaments need in order to grow as well as function appropriately.
You had mentioned before that you practice jiu-jitsu. Have you noticed that the BPC 157 helps with any of your discomfort?
Oh, yes. Yes. As well as weightlifting, both. For jiu-jitsu requires a lot of quick movements, turning, twisting, so there's always a high possibility of getting injured. A lot of knee and shoulder injuries, as well as back injuries that can occur. The BPC can help take some of the pain away. So I've noticed a large reduction in my pain to the point where I don't take any NSAIDs or ibuprofen, Tylenols, naproxens. I don't take any over-the-counter pain medications anymore. When I first started jiu-jitsu, I was always going for the ibuprofen to help with my inflammation and my pain and my achiness. And I don't do that anymore. So that's a huge improvement overall.
I was actually doing my own research on BPC 157, and
Nice.
one of the interesting things that I read was that it can ameliorate alcohol withdrawal symptoms and oppose alcohol intoxication and addiction. Can you go into a little more detail explaining that?
Sure, yeah. So amorellates is making something bad better. A very generic term. But when we talk about like alcohol withdrawal, you kind of want to think of all the symptoms you think of when you're hungover, like hungover symptoms. It helps to decrease those symptoms. And how a lot of it does it is acting on those opioid receptors by decreasing the pain. Also increasing serotonin and dopamine so that you feel overall in a better state of mind. So it's very good at helping with that. You said the other part of the question?
It was that it can oppose alcohol intoxication and addiction.
Oppose alcohol intoxication and addiction? So yes, so when you're on this BPC 157, again, a lot of it is these neurotransmitters that it's focusing on. So when you have lower levels of dopamine and or serotonin, you tend to have more of depressive, anxious, not knowing what to do type of mood, irritability, aggression, things of that nature. Dopamine is what we call the reward center, and it's highly correlated with rewards. What I mean by that is if you don't have enough dopamine, your body just kind of goes through a steady state and a more depressive state. The reward center, for instance, in addiction, is the reason why people keep going back and back and back to the same addictions. So it's the chronic gambler, the gambler who keeps going back for some more, because they want that feeling of when they won to be back again. That's the dopamine that gets released into our brain. The drug addict, someone who uses drugs, the same kind of concept. They continue to go back to the same drug, get into more drugs, and increase their drug use, maybe it be frequency or how much they're using it, for the same reason. They're trying to increase that dopamine, to get that reward, to get that happiness feeling. And it could be an ever-long search that they may never find again. You can also be born without enough dopamine as well. Which can be seen in children who have like ADD or ADHD tendencies or behavioral issues, as well as people who have leaky gut or gut, what we call dysbiosis, which is an imbalance in the gut, which doesn't allow our bodies to produce the normal levels of these neurotransmitters in our gut, from our gut to go to our brain. So we see that a lot. So what BPC 157 comes into play is by helping with addiction, what it does is it's increasing your dopamine naturally, it's increasing your serotonin naturally, and it's allowing for people to help get off of these drugs and then not crave these drugs. Same thing goes with alcohol. I don't drink alcohol that often, but when I started taking this BPC 157, I was amazed that I would go to people's houses, get-togethers, and dinners, and I wouldn't even think about drinking alcohol or wanting to drink when offered. So it's a very interesting medication in that instance as well. The BPC helps you feel overall in a better state of mind, an overall well-being, more positive outlook on life, feeling content with what you have, and giving you the ability to and want to drive farther in life.
That seems amazing. BPC 157 seems like it could do it all.